to it going back and just show it to your staff.
Morning.
Good morning. Hi, Jay. How are
Hi,
you?
I'm fine. How are you?
I'm doing good. Thank you for putting a team together for this demo.
No problem. And I'm joining from my desktop too, so it's easy on my eyes.
Oh, yeah. Good, good, good. You could see my screen, right? I'm sharing it.
Yes, yes,
Okay.
I can see. We can start. Rush, our CTO, is also on the phone, and
Okay.
he will be handling the majority of the client communications with respect to credentialing. So I told him specifically that he should
Perfect.
look at the demo. We are ready
Okay.
and
So
all
I'm
good.
also recording it so that you can guys have a link later to look back and see, go
Oh,
just kind of
that
review it.
that that will be great because that way then we can give it to our
We
Deepti,
also include one other representative. So let's include Dipti on this call. She'll have a lot of
No,
insight as well.
fine, Rishabh. Why don't you text Deepti and ask her to join, and then we can get started because then we.
Okay.
And Olga, how long will this take?
I would try to fit it in within 30 minutes.
Perfect. That will work
Okay.
because 11:30 we may have to jump out, so that will be great. Perfect.
Okay. All right. Perfect. Let's start. So my name is Olga and I'm managing a credentialing team for over 23 years. And we always wanted to do credentialing in a program that could help us organize it better, especially with the remote team and the team that we have in a different country. So we worked with different programs, and eventually 5 years ago, we were financially steady to develop our own. And 2 years ago, CredyApp went publicly live. It is currently used by billing companies that are doing credentialing. It is used by large substance abuse centers, urgent care facilities that are doing credentialing on their own, and also credentialing companies. So that's how this product was born. This product has unlimited access to users, to doctors. The cost of the product is $250 a month, and it's month-to-month subscription. You're not signing for a long-term commitment. So I'm going to show you the product, how it works. So everyone that logs in has a dashboard. I, as a manager, my dashboard shows entire team's work, all of my active, inactive, all the clients, and all of my workers. So it starts up with 30, 60, 90 days. I can see when the information was entered, and it changes the data as I change the data set. So this first part of the dashboard shows to me all the open statuses that need attention that are currently in progress. So I have info requested, I have 10. If I click on it, I get to see who are the people on my team working on this account. So Dimitri has one group assigned. This is the plan that his info requested, means he had requested something and still has not submitted yet. And it flux different statuses here. In progress, I have 19. I have my staff. I can see what they're handling. I use this for internal meeting for better control of output, of what's going on with our results in credentialing week to week. And this kind of rotates, and you can see panel closed, which I can go back to and see where we have issues, what plans we need to. So this is a dashboard that every single user has. If you're not a manager, if you're just a single credentialer, you'll just get information about yourself, but the manager will see everything. This bar over here, it tells me quickly, visually, the load my staff has. So each color represents an individual and amount of workflows they have, excluding approved, cancel, and panel closed. So these are active workflows. Further down, I manage expirable documents in two ways. First, expired, I get to see the name of the client, whether it's the individual doctor, whether it's the group, and I get to see the name of the document that has expired. So this column tells me everyone that has expired document that has not been replaced. All of these doctors, all of the office managers, they have access, and they could see it in their profile as well. So there are several ways we control document update, either through emails, either through notification by phone, or through client's portal. You decide if you want to give access to your clients. They will be able to see notes, they will be able to see progress of your credentialing. It's your decision and you can limit what they get to see. But expirable documents are there always because we want them to be notified. And there's like a little bell here that tells a notification what is expiring. So we are definitely have enough proof to say that we have requested this. This tab tells us of the doctors or groups that have documents coming up soon to be expired within the next 30 days, same logic. And I can click and I can go inside, but not right now, not to save a little bit of a time. This area is the hot topic. So these are the problems where there is a delinquent workflows, meaning that there could be Aetna, could be Optum. This is the place where the insurance companies might have extended the credentialing process for whatever reason. We're definitely over 90 days. We are delinquent. Or it could be a client who is not providing the documents, or it could be a Medicaid enrollment that's pending all other applications. Whatever the reason is, it's considered delinquent. And there's also a little one called here overdue follow-up. There is 10 for them. So again, the same logic. I get to see who is working on what and where is the problem. Further down, I have today's follow-ups. So I get to see quickly what is scheduled for today, August 29th. These are for all of my users. I get to see scheduled calls, emails, whatever the task was planned for today for my staff, I get to see it under my user ID, and an individual user sees it on their user ID. I get to see the group name, provider name, insurance name, work type being done, what is the current status, assigned to who in my company, and when was the last follow-up. I'll quickly show what else I do with this. So when my team plans a vacation or personal days off, I quickly delegate the work, a scheduled work through here by opening up a calendar and quickly reassigning to different staff members the work so I don't miss a follow-up or simply reschedule. So this is how I would use the follow-up module. Final thing on the dashboard is your kind of like a dynamic graph. I'm sorry?
Like a specialty type.
Yeah, so you get to see based on taxonomy code, who are your clients and where they're located by specialty, by state even. So it's a pretty good visual, especially if you're going into IPAs and you want to drop in your clients there, you get to see the breakdown. And I'm mostly in New York, so I think I have a lot of New York here. Yeah, New Jersey here also, but you get to see the breakdown. So this is the dashboard that tells you what's going on for today for your entire team and the management and the users. Any questions?
Two questions. One is within like me being in the billing company, we would have some groups, some individual providers. So is there any limit on the number of group providers?
No.
Good. And users, sometimes,
No.
as you know, like one person does the phone call, one person does this, one person. So we can create no users, no problem at all.
Correct. I've never wanted to limit your use of the program or to charge you for extending and growing your company. So we do not have a cap on anything.
And from the client perspective, would client be having any kind of a semi access or something to the dashboard so they know, or we just send a report out via email? Like, our clients are very demanding. They want every Friday an update.
Okay, so I understand exactly. So we did this program also to kind of reduce, I'm going to show you what the client sees. We did this program also to kind of reduce the phone calls to my company. Yes. And during COVID, this really saved us because we were all working remotely. Our environment changed. So this is how the client logs in, and this is the information they get to see. So you control what they get to see. Their visual is a lot different than yours. So they have the bell here. They have different notifications that come up here. You map up the group's name, the providers they get to see. So for example, some office managers have to control multiple doctors. You link up and merge multiple profiles. They literally get to see documents and anything taking place with the insurance. Let's say they want to see all the approved one, they get to see it right away. They can export to Excel. They can see it quickly. Anytime you update something on your site, it updates live here. So you can always direct them to the program, but this is the information they can export to Excel quickly to see it. If you do not want them to see notes of your calls that you make, you can limit what exactly they get to see. But otherwise, they get to see the notes as well.
Very good. Thank you.
Okay, let me go back to the visual back here. Hold on a second, right here. So this is the bar that I just opened up through here. This is the shortcut. So we talked about the dashboard. So I'm managing 1,108 doctors that are active right now. If I need to quickly add a doctor, all I need to do is enter their NPI. We are connected to the CMS registry. We pull the data immediately and create a profile. If the NPI doesn't exist, it's a brand new graduate or whatever, just started, you're going to key in the information to start creating the profile. Once that is created. So once you're in the provider section, you have an option to add another provider through here. You can search by simply doing the first 3 letters of first name or last name. It comes up immediately. What you get to see, and you have groups you can search by, states, providers, email, CQH ID, any individual thing will allow you to search. When I searched for Dr. Majumba, I wanted to show on him because he has 3 specialties and very cool guy. So I see right away, first name, last name, date of birth, NPI, degree, when he became my client, which user in my company created this profile, how many groups he's part of. Building companies told me this is a great thing because it quickly tells you what other credentialing he has gone already or what he's pending for. So you get to see his 2 tax IDs he's in credentialing with. That's a quick visual there. You click on the pencil, you get inside his profile. His profile also shows you things that are expiring for him quickly here with the bell. And also you have other ways to see it. So his profile, you know, you kind of select who he is, a specialist of PCP, NPI, social, gender, everything that Medicare needs, data of country, where he was born, what country, what language, what is the secure zip code, Medicare ID, revalidation soon. So you get to see all these things immediately. It pops in because of the NPI access. The date of death, if they passed away, you archive the files, still have access to it. The program allows you to email. So as soon as you plug in the emails here, you can email to your clients the approvals without calling them. This is the note box for internal notes. So his wife is the main communicator. My team sees these notes and they only follow these specific rules. These are not notes with insurance company. I can generate a quick summary report. This is not an insurance report. This is more of a professional data report, not a CV either. This is a board, Medicare ID, medical license, everything about the provider on a professional level. They usually take this report for their onboarding with the hospital or reappointment with the staff or something else. Professional information. We store the CAQH access and the last reattestation date, give you the link where to go. We are not connected with CAQH. We cannot afford the luxury yet. It's a very expensive bridge, but maybe one day. PICOs, we give you access and you can go in by using the user ID and passwords. Professional liability, CDSDA, all of these expirable dates, if you keep track of them, the dashboard will notify you and the program will notify you as well. And you can upload an actual image to each file. Medical license. With COVID, everybody went into telehealth, so you can manage as many state licenses as you want. Just make sure there's a state and information uploaded. We manage school information, whatever they finished and graduated with. Specialties. So it doesn't matter how many specialties they have. If they're attached to the board certification, each specialty in priority, specialties are all available here through a drop-down selection and have a taxonomy code that pulls that analytic for the dashboard. And you have the expiration date. Again, if it's here, we'll tell you when it expires. Add as many as you want. Internship and residency, you choose what they want and add whatever needs to be done. So pretty quickly here. Facility location. So you get to see quickly and manage easily all the locations for the doctor, from paid to primary service location. Everything you need is here. You can go in, you can edit. Everything, notes, Clio ID, everything for the location is here, including the NPI and type of location it is. You can add a new location quickly. You can copy the location from any other group that you're managing. So it's a lot easier and saves you time. On the main screen, you do have the start date, the end date, inserted date, and a couple of the notes that will pull from there. Hospital privileges have a special separate tab because some providers have a lot that concerns credentialing. So same logic, as many as they have, and end date is important. Insurance. Yes, Jay.
Yep. Sorry, I got disconnected, so I had to come back again, but you're fine. I am on.
Yeah, and we are recording, so you can go look to it again, of course.
Yeah.
This tab is insurance information. It tells everything in a quick glance. Again, quickly. We're gonna go into details soon when we do it. This is a quick visual to see what work has your company done for the provider. You can extract into Excel. You can go in with the pencil here and see the details. It's a quick summary of all the credentialing work. Let's say you're on the phone with the doctor, and he's adding requests. This is how quickly you're doing it. First, you select the group. We kind of guide you through tabs what to do next. So you select the group's name. There's some things that are popping up around. Just ignore it. Click tab. It gets you to the right information. You choose the doctor. We've created a program where you are, either if you're on a phone or your email, you can always copy, and you have shortcuts. So let's say the insurance rep is asking you for more information that is available through the workflow. You have the shortcut to the group itself. Same thing, you have the shortcut to the doctor's profile. So you always have these shortcuts, so you don't have to go back and forth. So let's say the doctor says, we need Aetna. We are giving program to you with the license of 1,486 insurance profiles, but you independently are able to build your own library by adding more plans, or modifying the plans by adding contacts of the representatives, emails, phone numbers, who are the best people to talk to at this insurance. So there's no more sticky pads, everybody on the same page. We have the library and we all share the contacts. So from here, you can create multiple workflows. Workflows are tasks with insurance company, demographic updates, whatever we are doing, whatever the doctor needs with the plan, it's all here. You can do as many as you want through this window, then you will save it and it will create individual workflows for all of these plans. You assign a work type, and we give you the work types. We give you a lot of them. There's a lot of here, or whatever happens in the credentialing journey. You're able to add more if you need to. Honestly, there's a lot here. You can assign it to your staff member. You can leave it blank, assign later. And you can create a status, need signatures from the client, panel close, whatever it is that you're doing with those insurance company. Most likely, if it's brand new, you need to submit. It's a reminder you're going to schedule for yourself, and it's going to remind you that day on the dashboard when you're going to be logging in. And you save the information. Information always, there's a bar that tells you it's saved. There's never, you're always in control of what's going on. So this is how you would create new tasks fairly quickly. Now let's look at attachments. We are managing in one tab, and we pull in together for this doctor all the attachments. Green stuff are perfect, not expired, still doing well. You can see remaining days here, and you can see what type of a document it was, when it was inserted, issue date of the certificate, expiration date of the certificate, and which user inserted. Anything in red, it means it expired. It needs to be replaced. This particular document is a malpractice insurance. I can download, I can delete, I can do whatever I need to do it. And it's 50 days over. It has not been yet renewed. Recredentialing. If you are managing recredentialing, I don't know yet, but we track recredentialing date from the first time it's approved. I'll show you later how we do it. Credit tracker, CME, CEU. If we are maintaining the license, we need to track their CME credits. So we add them through here, and we give them the report whenever they need it by generating for them. Sanctions. We cannot do our credentialing if our doctor has OMIG, OIG, or fraud accusations. We need to know about them. So this is where we keep track of it. Yes, CQH also has it, but I need the client to disclose it to me so that I have all the information, and we can attach the documents here. Covering provider kicks in if your nurse is using collaborating physician, or you're working with a OBGYN psychiatrist or internist. They'll be able to create their covering provider for them. Internal data is a field that we leave it up to you. We customize it together. This is something that you want to have in your physician profile. So we have an empty space. Checklist is where we check off what we have received for the client. In the next 2 weeks, we are adding here the date this was marked and which user ID marked it, so that we have more control over what we are doing and who is working for us. So we have this information. I give you the list, but you can tell me what else you want to add, maybe very specific to the billing service. I don't know, but we create the list together. I'm giving you the basics, and then you guys give us whatever you want to give us.
Got it.
Provider.
Any API to the CAQH, or it's still?
No, we can't. We have to be first accredited as an NCQP company. And
Ah,
that's just it's a crazy amount, Jay. We're not at that level yet.
I agree. I
Maybe in
agree.
5 years, maybe. It's basically
Right.
there's a maintenance fee and an onboarding fee. So it's huge. That's why insurance companies have it, but for us, we're not there yet.
We cannot afford. Absolutely. Yep.
Yeah.
Yep.
So groups, next one, same logic. I manage 531 tax IDs. These are tax IDs, urgent cares, pharmacies, DMEs, any entity that has a tax ID. Same logic. The NPI is present. It's going to pull the data. If NPI doesn't exist, you're going to go through step to create the group. Once you're in the group section, you can search all your clients. You can add a new one here. I'm going to back to my guy. He also has a group. It's a PC. I get to see the NPI, tax ID, and any kind of notes, when they became my client and who is the user ID, same logic with the pencil. Get to see their NPI for the group. This is everything for the group. Everything. Clear, tax ID, DBA, one of the main locations, their Medicare group ID, Medicaid group ID, same logic of the emails and notes. Professional info means license for the facility. This is the license like ambulatory surgical center. These are licenses for the tax ID. Add as many as you want, keep track of the dates. If they are accredited, same thing with accreditation. We pull in a lot of stuff here from our listings. So you do have things here already in alphabetical order. And you add as many as you want. Professional liability for the group, as many as you want. General liability for the group. Facilities and locations, same logic as the doctor. I'll skip this part. Providers, you get to see quickly who are the doctors that are part of this tax ID and what type of credentialing we are doing for them. There's a change going on here. You can export by the status into Excel. All of the exports are Excel. Similarly, if you are working now in Excel or using another credentialing program that is Excel based, I'm able to import and create all of this for you on the basis of your own data. So it's a quick start. Insurance information. This is all for the tax ID. All these groups approval are for the tax ID. Attachment, same logic. Ownership. We need to know who is the owner. We need to disclose with Medicaid and Medicaid HMOs. This is where you will put in the information about the owner. Checklist, same thing, create W-9, Pecos login, whatever you want to do, we'll do it together. Recredentialing, okay. Follow-ups we talked about. Insurance library you built on your own. I'm only giving you what I have, but eventually what it would look like, it will have a listing of your own library with all the contacts that you can modify and everybody can share it. And it definitely saves time by contacting the insurance company. Now I get into a very important field, and we have about 6 minutes, so we'll get it done. So workflows. Workflows are existing processes that are submitted to insurance company, and they can be under varied statuses, right? It could be info requested. I'm going to show you how we work with in progress as one of the best statuses. So you can search by CQH ID, by specialty. You choose the filter. Independently, each filter works. In credentialing for my team, I carry by due dates and expected timeframes, that especially those that I gave to the client. So 30 to 90 days, I am feeling all right. I'm not panicking. I think we're okay. I will be double checking what's going on, but my attention always goes out to processes or that are over 90 days, 120, 180. This one particular, I am on it on top every single day, sometimes twice a day. I want to see this number go down. So I created I selected status in progress, anything that tells me that it's 180 days over. Apply a filter, I have 280 problems. They're alphabetized here, but I can also filter them more through here by working with a specific employee or filtering by a specific group, doesn't matter. But if I open any of them, first of all, the visual, the group's name, the provider name, insurance name, and you can sort. So let's say you call in the insurance company, you want to call everyone at 11:99 at the same time. Here it is how you do it. You see the work types, status, assigned to your company, who are the people, when the application was sent out. Application also means a request, demographic change, whatever you're doing, and how many days passed. If I'm going to go into any of them, I get to see the last follow-up date. I get to see this application is 295 days old. Oh my God. I see it's a physical therapy practice. I have their information. I see the provider. I see it's $11.99 and we're doing individual enrollment. I see it's signed in Lena. It's in progress. It's partially paid because we charge for credentialing. You do not need to input these fields if you're not going to use them, but they're there for a reason because they give you a good performance understanding. If this client was approved, if this $11.99 and this provider under this tax ID was linked, I'll be able to enter information of the approval provider ID, effective date, and here is the recredentialing date that you're going to enter. That's going to be usually what, 3 years from now for $11.99, and it's going to save, and it's going to remind you on your dashboard of when it's coming up. So you always know 30 days before this day is up that there's a recredentialing coming up. I can add the plans, I can key them in, or I can import the files. Usually what I do is I import the contracts, I import the rate sheets. So it stays here together in one set. I don't have to find it online. I don't need to ask somebody. It's here. I can see it. I can add a quick note. Usually I use this EFT related. If it's EFT kicks in and when. And this is the insurance tracking ID. If the insurance is like Pecos or Aetna gave me escalation case number, anything that insurance gave me when it comes to tracking, a tracking ID or reference number of the application, I will add it here. This is USPS, FedEx, and UPS tracking ID if the application went out on paper. A lot of Medicaid still goes out on paper. This is the group's email. If I'm going to put your email here and send you an email from here, you'll get information about this approval. This is where the application send date starts tracking. This is when the application after the insurance received. So it's 295 days old and it was not yet approved. And this is the journey. This is all the credentialing notes. You can limit your clients from seeing this. But I, as a manager, live in this world through these notes. I work with understanding what is taking place with this insurance. To add notes, it's quickly. You have different note types. Communication with insurance, communication with client, whatever you select, whatever note you will do, it would always save the note on top with the date and time and the user's name, which you can't change, it locks in the program. And you're able to see what happened from the beginning, from the bottom up, what happened from the first step of the application till now. And this history stays, you can't edit it, it's always there. So that's how you track that. Let me see here what else is left. Add a user very quickly. You identify who is your user. We have different levels. If you want everybody to be on the same, then they're experts. This is the only time when you use the provider, when it's an office manager or a doctor themselves, and you send them invitation right from the program. I did provide you with exclusion links from federal and state, so you can check your OMIGs. Again, we're not built-in interface. You go to the website, it opens up a tab, and you search whatever you need to search. If you are working with existing users that you're already assigned, check out how easy I can edit what my user gets to see. Once I select the user, I have here an option to map out their plan of work. I map out the groups, the providers, or any individual workflow task. And it takes time a little bit to load because I have a lot. It's going to load and I'm going to able just to click. This is what I do. I control what my users get to see. If I want them to see everything, they get to see everything. And the same thing for the providers. That's it. If you want me to go quickly, I just did. Any questions, guys? What are you using now? Anything that you want to ask me that helps you run credentialing better?
Yeah, no, that was really good setup. Right, currently, I believe we're just putting everything into like an Excel book. We don't really have sort of tracking mechanism that we're using particularly right now. But this is really informative about everything that's happening here.
Yep, I agree. And currently we are just doing the old method of Excel, and credentialing is not our forte or our main line of business. So it is more just helping our clients out.
Right.
So this will surely help. Being in RCM, as you know. My only one more question I have for you, Olga, is if I cannot handle the client from a credentialing point of view, if I refer to you, what are your typical charges for credentialing services? let's say for any new client that I acquire.
Oh, it's different, Jay. For example, it depends on their, okay, I'll give you an idea. So if it's a doctor who is already has an existing credentialing, doesn't matter under any tax ID with that insurance company, it's 560 per insurance.
560?
Yes, 560 per insurance.
Got it.
If it's a client who is brand new, they just starting out like new tax ID, it's 1200
Got it.
per plan. Yeah, we are on an more expensive side, I think, but we give really good quality.
Absolutely.
And you know who comes to us? Hard cases, people who can't do it on their own. They tried already somebody else, but either the panel is closed or it's contract negotiation. Our pricing has always been based on hard cases, and I think that's what we are known for in New York.
Correct.
And smaller size credentialing typically doesn't come to us unless they have nowhere to go.
Oh, got it. And what does your service include? Basically,
whole process till the approval. We are an external credentialing department for the provider until they're approved. All communications, including site visit.
Got it. And then sometimes, you know, the providers will ask me, can you get me in United, or can you get me here or there? Anything that you can add that I can count on?
IPA. So we have a collaboration with 7 IPAs in New York.
Okay.
So we are able to put the client into IPA, but if the IPA has a resistance from the insurance company, I will tell to the client right away before we start applying. So we are already so embedded with these IPAs, we get their updates pretty quickly. And radiology today and physical therapy, I can't do anything either. We have to get to we get political support a little bit, right? We get like a letter of a local conference, but congressman, but these two specialties are unfortunately marked by Health First, by Optum, by MetroPlus in New York. And we do credentialing nationwide, but it seems to be the big cities are blocking specialties.
Yep. Very good. I think it's very good, Olga. And and then for from a billing company wise, is any room for wiggle room for your 250 per month?
Not at all. We have a flat fee for everybody.
Flat fee. Oh, got it. And there's no limit on the
month to month. You sign an agreement, but you are not, you're not paying up front. You just pay month to month. If you ever decide to leave or whatever changes, COVID really shows us how the world isn't perfect. We extract the data into Excel, and you can download all the attachments yourself, and we give you the data back.
Wonderful. Thank you very much.
I'll send you the recording, and Barno will just follow up with you in a week.
And please forward me the video so that
yes, I'm forwarding the link with the password.
Wonderful.
All right. Thank you so much, guys. Thank you, Barno. Bye-bye.
Bye.
Thank you.